we are going to discuss the psychiatry or mental health nursing. Today's disease is the major depressive disorder. So, major depressive disorder can affect our feelings, thoughts, or behavior, and it can occur after any loss or including loss of self-esteem or end of a significant relationship just broke up, right? After breakup, or also death of loved one or any kind of traumatic events. So I said, when a patient come to you with a depression, especially major depressive disorder, we can see all of the sign and symptom are negative. What does it mean, negative? It does mean we say the patient is very sad or feeling empty or no pleasure about the life. They all the time they crying or they don't like to eat and they weight loss, feeling fatigue, and their mood is switching. Hmm? So all negative sign is most common in depressive patient. What else? So depression may be mild, moderate, or severe. And the general treatment, including the counseling or psychotherapy or medication like antidepressant medication, or we can give them electroconvulsion therapy as well. Sometimes individual counseling or group therapy also very effective. Let me explain one by one. So first one is a mild depression, then moderate and major depressive disorder. So if I ask you, what are the underlying cause of depression or what are the risk factor? You can tell me maybe the patient has a history of any traumatic events or someone death passed away, any wonderful relationship suddenly break down. But all of these are events, right? Anytime can happen in our life. But more accurately, the risk factor, usually the patient give a history of positive family history, or usually the most of the patient are female. So female in between 15 to 40 years of old, they are more chance to fall in depression, or any patient over 65 years old. Sometimes you can see the major depressive disorder patient have a history of medical illness. So if anybody diagnosed by the chronic disease, they undergo depression or negative life events. Something is really bad happen with them, or patient give a history of substance use disorder. Sometimes a common question student asks, so if anybody being single do not merit like to stay alone, but the person who are single, the chance of depression. Okay, so the person who have a mild depression, so what are the sign and symptom? Or when you tell the patient have a mild depression, according to this PowerPoint, the mild depression is triggered by an external events and follows the normal grief reaction. Mild depression lasts less than 2 weeks. But what about if the depression stays more than 2 weeks? So when depression is more than 2 weeks with 5 or more of the following symptoms like depressed mood, insomnia, difficulty of concentration, suicidal ideation, that times we call major depressive disorder. But here we are going to focus mild depression. So there's so many books agree with us when the sign and symptom lasting less than 2 weeks, we call mild depression. What are the other sign and symptom? Patient feel sad or feeling let down or disappointed. Mild alteration or sleep pattern, feeling less alert or instability. Also disinterested in spending time with others. They like to withdraw themselves from the society. Sometimes increase the appetite, sometimes decrease appetite, or increase use of alcohol or drugs. So patient think if I drink more alcohol, I will overcome it. But reality is not like this. So in case of moderate depression, patient moderate depression persists over the time. The person experience a sense of change, or often looking for help. Or also dejected or low self-esteem. They have a very low self-esteem. Or they can feel helplessness, powerlessness, or may experience intense anxiety or anger. And their mood is switching with the time or day. And some patient present with anorexia, fatigue, or flat facial expression, or the depressed patient always poor grooming or poor hygiene. Their thinking system is very slow. They slow to pitch or in decisionness or psychomotor change. And always negative thinking is more, even suicidal thoughts, sleep disturbance, anorexia, weight loss, and fatigue. So depressive patients do not like to eat. How body weight will be increased? Definitely it will be go down. Or some patient has a menstrual changes, hmm? Or increase use of alcohol or drugs. And what next? Next one is a major depressive disorder. When you see your patient has a major depressive disorder, the most important is safety, because the patient who undergo the major depressive disorder, they have a ideation of suicide. Hmm? Because of suicide, safety is the priorities. Then NCLEX board like to ask this question. So major depressive disorder, we always provide one-to-one observer, and we ask the patient directly if they have any plan for suicide. Also, we will looking for sign of suicidal ideation. If you see the major depressive disorder patient have elevated mood, they have a more chance for suicidal ideation. Okay, so we initiate the suicide precaution, right? So the person who have a major depressive disorder, what are the other sign and symptom? And before to go other sign symptom, I want to share something first. So if the depressive sign symptom occur every day for more than 2 weeks, we with 5 or more of the following sign symptom. Following sign symptom means hopelessness, feeling guilty, flat affect, poor posture, slowing in the speech, self-destructive thoughts, social withdrawal, poor concentration, suicidal ideation, weight gain or loss, all of this, right? Or psychomotor increase or decrease. So if we see any 5 sign symptom more than 2 weeks, we said it is major depressive disorder. So sometimes some of the patient are depressed during the winter, but they're okay in summer. So we called seasonal affecting mode, SAD, typically occurred in winter, and light therapy is the first line of treatment. Sometimes we see the depressive disorder after menopause, or even we can see after, during the menstruation cycle, before or after their mood is switching. So it is associated with luteal phase of menstrual cycle. It's called PMDD, right? In that phase, the symptom is rapid mood switching, or overeating, or difficult of concentration. It's also different form of depressive disorder. And some book categorize the depressive disorder have three phases: acute, continuous, and maintaining phase. So acute phase here, it is severe clinical sign of depression. So depression is a chronic disorder, but when exacerbation, acute attack, we call acute phase of chronic disease. So in this stage, severe clinical sign of depression or 6 to 12 weeks of duration it stay, or possible need for hospitalization. In acute phase, the greatest risk for suicide during this phase. So if your patient in acute phase, 1-to-1 observation must need. In acute phase, our goal of treatment to reduce the depressive manifestation. What is depression manifestation? This one, right? This one. Guilty, slow, poor posture, poor grooming, hygiene, slow thinking, psychomotor change, all of them. Another phase is called continuation phase. Continuation phase increase the ability of function and 4 to 9 months in duration. The goal of continuation phase relapse the prevention through the education. So if you give a good counseling or individual therapy or group therapy, good education can prevent them undergo to the major depressive disorder. I mean, psychotherapy can work or medication therapy. And last one here, maintenance phase. The remission is most important here. And maintenance phase can last for 1 or more years. If anybody has a maintenance phase, our target or goal, prevention of future depressive episode. So our target, prevent to attack the acute phase or continuation phase. Next here, the how as a RN or LPN, how we interact with them, right? Intervention. So before to go intervention, let me read it. The major depressive disorder, severe psychomotor retardation or anorexia or considerable weight loss, constipation, or patient develop the lack of sexual interest or terminal insomnia, or some patient develop delusion or hallucination. So delusion and hallucination are typical sign of schizophrenia. But when a patient are depressive, especially major depressive disorder, they have a chance to develop delusion and hallucination. Delusion means a false fixed belief. Hallucination means the sensory perception, but there is no stimuli. Different way I can share with you. Delusion means the false belief in mind, but hallucination means false belief with sensory component. What does it mean, sensory component? Means hearing or touching, smelling, or any feeling, any abnormal perception, right? So delusion, another term we call illusion. Illusion means misperception of a stimuli. So when we study the psychiatry, we must know some keyword like delusion, illusion, hallucination, neologism, or what salad, idea of fight of idea, then dementia or delirium. It is good to know. So what are the intervention, right? So the most priority when a patient come to you and when we will go for cohorting, it is good, do not allow them in private room. So no private room, because due to risks of self-harm or suicidal ideation. So communicate with simple sentence. Allow extra time for response. Why? When you ask something, then be silent. Allow your patient to organize their thinking and allow them to verbalize. But if I ask why you give them extra time, right? Extra time for response due to slow thinking or indecisiveness. So their ability of decision making is very slow. And if nothing can work, then we go for medication, right? Then we go for medication. Especially depressive patient, we give them antidepressive medication. It is called TCA. TCA stands for tricyclic antidepressant. This is the drug of choice. Or we give them atypical antidepressant if TCA does not work. Other medication we can use for them, it is called SSRI, right? SSRI stands for selective serotonin reuptake inhibitor, or we give them SNRI. So difference between these two, this is called selective norepinephrine reuptake inhibitor. Or another medication we can use for major depressive disorder is called monoamine oxide inhibitor, right? So another question sometimes NCLEX board asks, the alternative therapy or herbal therapy we use for them is called St. John's wort. But when you give them St. John's wort, do not give any antidepressant or SSRI or SNRI together. So that is more than enough for depressive disorder.